Hello, everyone. I'm glad to introduce this detailed discussion on Alzheimer's disease, a condition that has become a challenge in today's medical and neurological practice. In this presentation, we will discuss the multifaceted nature of this neurodegenerative disease, talk about the biological underpinnings of the disease, symptoms, and effects on patients and their caregivers. This presentation is designed to give you an understanding of Alzheimer's disease and its impact on the neurotransmitter systems in the brain, how it progresses through the life stages, and the current research in this area. By knowing these aspects, we can be more aware of how complicated this disease is and to fuel the continuous fight against it. Alzheimer's disease, which Brige and Carman explains, is the most common type of dementia in the world. Its extensive review underlines the fact that neurodegenerative disease is progressive in its nature, which means it changes the structure and functioning of the brain. The Mayo Clinic report states that there is no cure for the disease and at this time, but knowing more about the disease is helpful in its management. It is most common in older individuals, but young people can also be affected by the condition. This introduction provides the background for understanding how Alzheimer's affects the brain and its functions and behaviors. The disease impairs several aspects of cognition, such as memory, reasoning, and control over emotions. This is due to the fact that as the condition progresses, it becomes more and more challenging for the patients, as well as their caregivers, and is therefore considered a major public health issue. The terminal nature of this condition underlines the importance of continued research in the search of better treatments or even a cure for the condition. According to Chiani, Alzheimer's disease can be traced back to its discovery in 1906 by Dr. Alois Alzheimer, hence the beginning of neurodegenerative disease research. His first patient was Auguste Dieter, whose case enabled him to define the basic characteristics of the illness. Modern studies have greatly enhanced the knowledge about the disorder by employing high-tech neuroimaging techniques to map the changes of the structure of the brain in living patients. Saunders have provided useful knowledge via post-mortem investigations, identifying pathways of the brain degeneration and revealing important indicators. Recent genetic study has assisted in establishing that there are certain genetic factors that can put people at a higher risk of acquiring the condition. In a research done by Young in 2023, there are different possible treatments being explored in clinical trials, from the conventional administration of drugs to the more advanced treatments. These various research methods taken together offer a holistic approach to the study and treatment of Alzheimer's disease, from past knowledge to modern scientific methods. According to Colbert, one of the initial and the most significantly affected areas in the Alzheimer's disease is the hippocampus, which helps in formation of memory. This damage can be attributed to the early memory loss symptoms of the disease. The cerebral cortex degradation results in poor reasoning and planning, which are critical for overall performance. Gonzalez-Rodriguez have elaborated on the impact of the amygdala compromise, which leads to the alterations in the patient's mood and state. Their work offers important information about the link between brain and behavior. Colbert further elaborates that the temporal lobe involvement is likely to affect language as it leads to the communication problems. These areas of the brain are affected by progressive tissue loss. This results in a chain of declining functions. This knowledge of the structural changes is vital in coming up with the right treatments as well as early interventions. This is because areas that are affected are all interconnected, and hence the effects are seen in cognitive, emotional, and behavioral aspects. Yang elaborately disclosed the fact that various neurotransmitter systems are affected in Alzheimer's disease. According to their findings, the level of acetylcholine are also reduced, which leads to problems with memory and learning. The same study also describes how the glutamate regulation is disrupted, leading to altered synaptic plasticity and neurocommunication. The dysfunction of the serotonin system has been implicated in the mood disorders and behavioral alterations evident in patients. Fluctuations in norepinephrine impact the patient's emotional state and stress response, accounting for the mood swings characteristics of Alzheimer's disease. These neurotransmitter imbalances lead to the multifaceted cognitive dysfunction as described in Yang's research. Acquiring information on these chemical disruptions is critical in finding the right cure. Most of the current treatment options focus on these neurotransmitter systems as a way of trying to correct the altered brain states. The dynamics between these chemical messengers underscore why it is difficult to address Alzheimer's with a single drug targeting a single neurotransmitter system. Presence of beta amyloid plaques between neurons is one of the defining characteristics of Alzheimer's disease. Cobert explains how neurofibrillary tangles are formed within cells and how they impair critical transport networks within cells and cause neuronal death. These processes prompt a chain of events that lead to the gradual disruption of the synaptic connections, thus affecting the flow of information between brain areas. The inflammation of the brain tissue leads to an unfavorable condition for healthy neurons. This inflammation may speed up cell death and contribute to gradual reduction in the size of the brain. This knowledge has been invaluable in the creation of new therapies. This is the reason why single target therapy has less efficacy when it comes to treating diseases resulting from interaction of these multiple pathways. Recent studies aim to treat different facets of these mechanisms at once in an effort to manage or mitigate the advancement of the disease. This knowledge remains relevant in the development of new treatment regimens and forms of therapeutic management. French notes that the early onset Alzheimer's is characterized by mild but noticeable alterations in cognitive function. The first noticeable symptom is short-term memory issues, which are frequently attributed to aging. The study shows that people experience more and frequent word-finding failures in conversation, which demonstrate the early stages of language development. The issues with planning and organization become apparent in everyday life. Although the patients may learn how to cope with it at first, it is common to misplace things that are associated with old people. According to French's work, the changes in mood and personality are usually gradual, but at some point they are identifiable by family members and friends. These symptoms are important for diagnosis and treatment because if the treatment is initiated early, then it is more effective. By identifying these early symptoms, both the medical professionals and the families can be able to notice the condition early and seek the necessary actions to be taken. It is crucial to know these early signs to seek medical advice and to help avoid worsening the condition. French notes that later stages of Alzheimer's patients are unable to remember events or people and are confined to a state of severe dementia. One of the most painful aspects for both of the patients and their families is the failure to distinguish between family and friends. The research also captures how physical functions decline incrementally, and this is reflected in simple tasks such as walking and eating. It is reduced to a minimum level, which makes it challenging for the patients to communicate their wants or even understand other people. The third and the last stage is total dependence on the caregivers, and this stage demands constant care and supervision. These symptoms, according to French, pose a lot of problems to the caregivers and the health care givers. It is equally important to know the symptoms of the later stage of the disease to be able to properly take care of the patient. These symptoms are severe at its stage and emphasize the need for advanced care planning as well as putting in place a support system. It is therefore important for the health care providers to collaborate with families in the management of the difficult symptoms without compromising the patient's dignity and quality of life. French gives a detailed account of the lifespan impact of Alzheimer's disease, where the average life expectancy after diagnosis is between 4 to 8 years. The study reveals that as the symptoms intensify and the individual's quality of life decreases, this can be particularly demanding as the patient's condition worsens over time and the caregivers are under a lot of pressure physically and emotionally. The effect on family relationships is significant as roles and relationships change significantly throughout illness process. The cost of care and medical expenses rise as the individual's needs become more complex and intensive. These lifespan implications highlight the need to start planning early and to seek sources of support. Knowing these long-term consequences enable family and medical practitioners to anticipate and plan for the future difficulties and choose suitable courses of action. The effects of Alzheimer's on the patients and caregivers show that there is a need for more social support and services. This knowledge helps to shape the support systems and care approaches that are put in place. According to Rua, drug trials that focus on amyloid plaques offer hope for improvement in treatments. New diagnostic tools and strategies are being designed to diagnose the disease at a very early stage where the symptoms have not developed fully. There is current research that is being carried out in an attempt to determine some of the lifestyle factors that could either prevent or accelerate development of disease. Rua also points to the growing prospects of gene therapy as a possible treatment strategy. The increasing concern with preventative measures can be seen as a shift in orientation of scientific effort, stressing the need for early intervention. These research directions give some perspectives on how a better treatment and even prevention of the disease may be possible in the future. This shows that Alzheimer's disease is a complicated disease and that there is no single way to address it. This is the reason why research and development should not be stopped, because there is so much more to learn and discover. Such endeavors may result in innovative therapies that bring about major changes in patients' conditions and well-being.